A kidney transplant is a surgical procedure in which a healthy kidney from a donor is transplanted into a recipient who has end-stage kidney disease or kidney failure. The procedure involves several stages and typically follows these steps. Evaluation. The first step is the evaluation of the recipient and potential living or deceased donors. The recipient's medical history, blood type, and overall health are assessed to determine their suitability for a transplant. Donors undergo comprehensive medical examinations to ensure they are healthy enough to donate a kidney. Finding a compatible donor. If the recipient does not have a suitable living donor, they are placed on a waiting list for a deceased donor kidney. The compatibility is determined based on factors such as blood type, tissue type, and cross-matching. Surgery preparation. Once a suitable donor is identified, the recipient and donor undergo preoperative preparations, including blood tests, imaging scans, and consultations with the transplant team. The recipient is also prepared for the surgical procedure, which may include dialysis to manage kidney function until the transplant can take place. Surgery for the donor. In a living donor transplant, the donor undergoes surgery first. The surgeon makes an incision in the donor's abdomen and carefully removes the kidney. The donor's remaining kidney is left intact as it is sufficient to maintain their own kidney function. Surgery for the recipient. Once the kidney is procured from the living or deceased donor, the recipient is prepared for surgery. An incision is made in the lower abdomen, and the damaged or non-functioning kidneys are removed. The donor kidney is then carefully connected to the recipient's blood vessels, ureter, and bladder. Post-operative care. After the transplant surgery, both the recipient and donor are closely monitored in the hospital. The recipient receives immunosuppressant medications to prevent organ rejection, while the donor undergoes a recovery period to ensure their well-being. Follow-up care. After leaving the hospital, both the recipient and donor require ongoing follow-up care. The recipient undergoes regular checkups and continues taking medications to manage organ function and prevent rejection. The donor also receives post-operative care and monitoring to ensure their recovery and well-being. It's important to note that the procedure may vary depending on the specific circumstances and the transplant center's protocols. The transplant team, which includes surgeons, nephrologists, nurses, and other healthcare professionals, plays a crucial role in guiding the recipient and donor throughout the process, providing support and education on post-transplant care and lifestyle modifications. Kidney transplant surgery is a complex procedure that involves several steps. Here is a general overview of how a kidney transplant surgery is typically performed. Anesthesia. The recipient is given general anesthesia to ensure they are unconscious and pain-free during the procedure. The anesthesia team closely monitors the recipient's vital signs throughout the surgery. Incision. The surgeon makes an incision in the lower abdomen on the side where the new kidney will be placed. This incision allows access to the recipient's existing kidneys and the blood vessels and bladder where the new kidney will be connected. Preparation of the recipient's blood vessels. The surgeon carefully isolates the recipient's blood vessels, typically the iliac artery and vein. These blood vessels will be used to connect the new kidney's blood supply. Removal of the recipient's non-functioning kidneys, optional, in some cases. If the recipient's kidneys are causing complications or taking up valuable space, the surgeon may choose to remove them during the transplant surgery. This decision is based on the recipient's specific medical condition and the surgeon's judgment. Preparation of the new kidney. The donor kidney, whether from a living or deceased donor, is prepared for transplantation. The blood vessels and ureter of the donor kidney are carefully dissected and prepared for connection to the recipient's blood vessels and bladder. Connection of blood vessels. The surgeon sutures the donor kidney's blood vessels to the recipient's blood vessels. The renal artery and vein of the donor kidney are connected to the recipient's iliac artery and vein. This connection ensures a proper blood supply to the transplanted kidney. Connection of the ureter. The surgeon attaches the ureter of the donor kidney to the recipient's bladder. This allows urine to flow from the transplanted kidney into the recipient's bladder. Closure. After all the connections are made, the surgeon ensures there is no bleeding and carefully closes the incision in the abdomen using sutures or staples. Postoperative care. The recipient is transferred to the recovery room and closely monitored by the medical team. They will receive pain management, intravenous fluids, and immunosuppressant medications to prevent rejection of the transplanted kidney. Hospital stay and recovery. The recipient usually stays in the hospital for several days to monitor kidney function, manage pain, and ensure the success of the transplant. The transplant team will provide instructions for post-operative care, including medication management, diet, exercise, and regular follow-up appointments. It's important to note that the specific details of the surgery may vary based on individual patient factors, the type of donor, living or deceased, and the surgical techniques employed by the transplant center. The procedure requires a highly skilled surgical team and comprehensive post-operative care to ensure the best possible outcome for the recipient.